joining us right now from Miami, Florida, Senator Marco Rubio. Senator, I want to talk to you about this rescue plan because you focused on small business. Were you the chairman of the subcommittee there? But at first, I want to get your sense of Florida. I saw those huge lines when it comes to food banks. How is the people of Florida responding to the lockdown?
Well, I want to say the people of Florida have responded well in terms of following the mandates. Obviously, there are people that try to get around and people that have to. You know, it's interesting, you know, if you work in a blue-collar job, you're probably out there having to work right now, whether you work at the grocery store, or CVS, Walgreens, or at some other place that's been deemed essential. And, of course, all the people, first responders and so forth. But by and large, you've seen that Florida has outperformed all of the models. It's not because the models were wrong. It's because we are doing our part. And we're going to keep an eye on that. And I also think our local hospitals across the state have done a great job of sort of building up capacity and getting ready to address whatever comes our way.
That's right. And I know that in the Senate, there's already some talk about another phase. Some of the points from the Democrats' next relief bill would be $250 billion in assistance to small businesses, $100 billion for hospitals, community health centers, and health systems, $150 billion for state and local governments, and a 15% increase to the minimum SNAP benefit, among other things. And one interesting thing that Senator Chuck Schumer suggested, Senator, is for up to $25,000 hero pay, essentially, for the people on the front lines, whether they are nurses or truckers or grocery store clerks, somehow the government compensating them for essentially putting their lives at risk every day when they go to work. What do you think of that idea?
Well, the way I think we should approach this is we need to bifurcate this into two pieces. The first is sort of what do we need to do to build on what we've already passed. So, for example, the Small Business Fund, despite some early glitches, is already at $66 billion have already been committed. So it's moving very quickly. There's tremendous demand. So that's why there's going to be an effort tomorrow to try to come in and add some funds to that. So building on what we've done, adding to what we've already done and passed. The second is a recovery bill. There's a relief and then there's recovery. And I think for recovery, some of them are deeper, more systemic reforms than we want to see, things like our supply chains and industrial capacity as a country on industries that are essential. And then maybe some of the things that you've mentioned. Look, these people that are out there every day that are delivering goods, we've had a run on paper towels, not just toilet paper, paper towels. And so those truckers that are making those long hauls overnight to get not just paper towels, but food and things like that into our grocery stores, not to mention our doctors and nurses who are doing a phenomenal job on the front lines. I'm all for doing positive things to help them after this very difficult circumstance. I think that, of course, is going to require a little bit more thought and maybe being able to bring Congress together to work through it. So I'm not saying no to any of these things. I'm just saying that those things are new and will require some more thought. And it's hard to do that right now because we're not in session. We don't know when we will be.
Yep.
Senator, the president is slamming the World Health Organization. I'm sure you know that. He says they've been routinely wrong. He said they were strongly against the travel ban back in January. He says that everything is positive toward China. They're not giving us the right information, and that the U.S. is the primary funder of that organization. We give the most money, but yet we don't get the most help, he says. So he's talking about cutting funding. Lindsey Graham says he's definitely going to do that. What do you say?
Well, a couple things. On the World Health Organization, let's remember that on the front lines, they have people all over the world that are doing a phenomenal job in terms of epidemiologists that are doing research and so forth. Our problem's with the leadership because the World Health Organization serves an important purpose. Unfortunately, it has been politicized. China has undertaken an effort over the last 15 years to sort of infiltrate and exert influence over international organizations at the UN and, of course, the World Health Organization. And what you saw early on in this pandemic is they went to China and came out saying that China's doing a great job, everything they're saying is true, and then condemning not just the U.S., but also condemning any country that considered bans on travel from or to China. And there's evidence of that it's been politicized, that the World Health Organization at its leadership level was politicized by Chinese influence and Chinese money. And that's unfortunate because that organization should not be political and should not be making public health pronouncements under duress from any country in the world. It should be making those pronouncements on the basis of medical science. And so I have deep concerns about it, and that's why I hope that at a minimum we can get the leader of that organization to resign because he's definitely been politicized.
Senator, every time I get started every sentence over the last few weeks with unprecedented, one of which was the $2.2 trillion plan to keep people in their jobs and businesses that aren't working funded. So part of the plan that you helped put together on small business, in some cases, is not functioning yet. Number one is when these people come in, if they can't retain their workforce at 75%, they won't be eligible to make that loan a grant, and if their people don't come back, it's out of their control. And number two is when you're done paying for your payroll, you don't have enough money to pay for your lease and your rent. So would you be revisiting some of that for these higher-priced cities like Los Angeles and New York and maybe even Miami?
Yeah, potentially. But right now what we need to do is more funds just to be able to get them out the door, because there's been a very strong demand for it. Look, a couple points to make. Number one, yes, I think I fully understand that people out there are desperate and want this to work. So do I. I also think we have to have some perspective. This is a plan that was passed 2 weeks ago this Friday. It hasn't even been 2 weeks yet. It was implemented 6 days later. Until Friday of this week, there wasn't a bank in America that had ever made a PPP loan, and there wasn't and the SBA had never made one. So this is a program rushed out in 6 days because we are in an emergency. When you have an emergency situation, it's chaotic. I know that from living through multiple hurricanes. You're managing the chaos at the same time as you're trying to get rid of the glitches that appear. And every day this program has gotten better. There are still some substantial obstacles in the way that need to be fixed. This can't be the way the program works long term. As far as the payroll is concerned, the point of the program, that's why it's called the Paycheck Protection Act, is to get money into the hands of small business so they can continue to pay their employees even if the business is not opening and running. And there is a portion of it that they can spend on rent, but we wanted the bulk of that money to make payroll so we can keep people off the unemployment lines and keep them from disconnecting from their employer. The government can't replace all the revenue of these businesses, and we never claimed it would, but we do think helping keep employees on payroll is a big assistance, and you can't spend a percentage of it. Now, if you can't hire all the people back or whatever, there are elements of this at the back end a year from now where you can show that I couldn't hire my people back because they had left or because of some other impediment, and you can have that mitigated and forgiven. But right now, the goal is to keep people employed and put money in the hands of workers. That was always the goal. That was agreed to on a bipartisan basis. It's not perfect. It certainly doesn't deal with every issue, but it deals with a big one.
Sure. Senator Rubio, before you go, we've all been on lockdown for a couple of weeks now. We try to say the day of the week as often as we can because all the days are kind of blending into each other. We saw the news this morning that apparently your colleague Rand Paul he's fully recovered from COVID, and now he is volunteering at his local hospital because he is a doctor. Just out of curiosity, in your case, what does a sitting member of the U.S. Senate do during a lockdown? What's your day like?
Well, first of all, let me tell you, theoretically, both Rand Paul and my friend Mario Diaz-Balart, a congressman here who was also infected, theoretically anyways, the assumption is that they have some immunity, because they acquired the virus.
Yes.
So that's I don't want to go through what they've gone through, especially Mario, but so that's a benefit for them, and it's something we should think about in terms of that new test that's coming on board to show that people have sufficient antibodies to be. But our basic day starts early with some media hits, and then I spend all day, probably 8 to 10 hours a day, either doing a series of conference calls or webinars with different groups in Florida and across the country. Yesterday, I talked to the Florida bankers, the National Bankers Association, and then a lot of phone calls with folks in the administration. I'll be speaking to the FDIC today about the program. Secretary Mnuchin's been phenomenal and accessible and very responsive. So really, the focus of my day has been largely on the program and getting it to work, identifying the impediments, and trying to do as much as we can here from home, using the phone, using this computer, and then communicating to the public as well. So that's been the gist of our existence here since we got back from D.C., and there's a lot of work to be done. And then trying to stay safe, trying to model the behavior that we're asking others to follow, whether it's wearing a mask in public. I don't look good in a mask, but I have one here that we made, and so I've been using that. And also, staying at home as much as possible and working from here as much as possible. So I've been quite busy, actually, but I think we all like to see life get back to normal as soon as possible, but we got to get through this.
We would. Thank you so much, Senator.